All right.
Good evening. We have a small crowd here. Hello, those people at home. I'm Marianna Varpalotai, and this is Elizabeth Brugman. And we are from Active Life Rehab Plus. That's our name of our physiotherapy clinic. We also gave our clinic a second name, now Concussion Management, because people don't know where to go when they need assistance with an mTBI. And so saying physiotherapy is not the obvious place to go. So we added a second business name to make it easier for people to find help post-concussion. And so today what we're going to talk about is vestibular rehabilitation and its role of post-concussion management of your symptoms and trying to alleviate your symptoms. Are you going to do that? And so I'm an athletic therapist. I've been practicing since 1991 for 30 plus years, and a little different from physiotherapy in that I specialize in sports injuries. I spent the first 20 years of my career working with athletes and athletes with concussion. And then I started to treat people from their help as people in the community, and I realized how many people did not know where to go and why I came up with concussion management. And I brought Elizabeth on board because I got busy very quickly. And Elizabeth specializes in vestibular rehabilitation, which is we were seeing more and more clients. I was used to seeing acute injuries, athletes that were recovering fairly quickly, and anywhere from 72 hours to a week to 10 days. But then I started seeing more and more clients who were having prolonged recovery. I was seeing them 6 months after their sustain their concussion. So we brought Elizabeth aboard because vestibular rehabilitation is a key component for those who are not recovering in a timely manner. Elizabeth is a physiotherapist. We ironically both went to Queen's University, which we found out only after we met. And Elizabeth, after graduation, did a postgraduate specialization in vestibular rehabilitation, and we'll take you through that. Most people consider it as vertigo is the most obvious form of rehabilitation for this practitioner, but it's much, much more than just vertigo. And so we're located on Lundy's Lane, Niagara Falls. Our running joke is the Sundowner is down the street from us. So if you really want a therapeutic massage, you have to cross the street and come to our clinic. And go ahead, Elizabeth. And so we'd like to thank Brain Injury Niagara, and in particular Sarah. I've been communicating with Sarah and trying to provide one of our, we opened in 2019, we found out so did your new location. And so we had the struggles of COVID, of course. And so now that people hopefully are attending, not as good tonight, but hopefully attending more and more events live, that we would reach out and try to assist people in the community. We have a sincere passion in trying to help people post-concussion, whether it's mTBI, mild traumatic brain injury, or an acquired brain injury, to hopefully improve their quality of life. And so we'd like to thank you who are here today and there who are with us virtually. And so we're going to go through 4 things. Our outline for tonight is we're going to talk about the inner ear, the part that we can't see, which is part where the vestibular system is located and connected to the brain, what, where, and how this inner ear works and slows down our recovery from a concussion or a mild traumatic brain injury if it's not working well. We're going to talk about mild traumatic brain injuries, which common term is concussion or acquired brain injuries, and the vestibular system and how they all work together. And then we're going to go through and show you how we assess our clients who come asking for assistance, and take you through. Hopefully, maybe those who are here with us today can be interactive. We hope to have you participate with this part, and how we do treatments, and what our goals are in trying to get you better, or having a better quality of life. At the end, we have lots of time for questions and answers. So Elizabeth's going to talk.
Okay, so just a couple of little fun facts about the inner ear. Yep. So mild to severe head trauma is the leading risk cause for dizziness. 100,000 Canadians will experience a brain injury each year. up to 35% of adults 40 years or older, about 6 million Canadians, will have vestibular issues in their life, whether that's vertigo or just the sense of feeling dizzy. I know I've had an episode. An estimated 33% of adults with chronic imbalances have problems performing just activities of daily living. And that's like your everyday laundry and things like that, which is really important for us to make sure that we're safe when we're doing that. An inner ear system helps us to maintain like our upright posture. So the fact that I'm standing here right now and I'm still or I'm moving, it talks to my vision and it talks to my body awareness, my sensory somatosystem. And it talks most importantly to the brain. So it gives us kind of feedback as to where we are in space and where we are in relation to our eyes and our body. Together, they coordinate our movements and our posture of our head in relation to the body and the environment. So the fact that I'm standing up is very much my inner ear telling my brain where I am in space and how I need to adjust. So this is just a good example, a couple pictures. It might not be as visible online, my apologies. One is just a picture of the ear, and then it shows how inside, deep in there, is our inner ear, and that's the inner ear vestibular system. It is very tiny. We have one on both sides. They consist of 3 fluid-filled canals. We'll go through that later, but basically it's saying how it talks to the brain, and then that helps us to work on our gaze stability, our vision. It helps us to know how to balance when we're skiing or surfing. It addresses our spatial orientation. So where are we in relation to another human being, to an object, so we don't bounce into it. And then just our autonomic system. So what that is our reflexive system. The fact that I can pull my hand from fire, or if I step on a tack, I can jump quickly. These are automatic reflexes that do interact with the inner ear system. We don't even have to think about it. And then this is just a fun dynamic picture of how in everyday use, from our dancing to our balancing, we use our inner ear to maintain our posture and everything. I'm sure most people notice, like with vacuuming and just picking up objects, the fact that we don't fall over is the biggest with our inner ear system, the vestibular system. So this is more of an intricate picture. This is a big zoom in of the ear. We have one on each side. So you see your external ear, that's where we have all of our earwax, and then our eardrum. But this is deep inside our ear. It consists of a coiled up cochlea, but most people are familiar with the 3 semi-fluid canals, and that's where the vertigo incident happens. But really the entire system is what helps us to know where we are in space. The circles are more importantly for knowing like head posture, but it's the other systems that talk to the vision, talk to the brain. So together it's a tiny, intricate system, but it works very intricately. This is a bigger zoomed in picture of the 3 fluid-filled canals. So most people wonder what exactly is vertigo. Vertigo is one entity, one problem of the inner ear. It's when the hair crystals in our 3 fluid-filled canals break free. And so when they break free, because it's full of fluid, they just kind of bounce around. And so that's the vertigo, but it's showing you how with the fluid, there's little hairs in there. And so when we move our head, the hairs bend either way. And that's actually what fires off the message to the brain as to where we are in space. It's the fluid pushing the hairs forward, back, side to side, or angular that tells our brain where we are in space. So what's the specific indication? So you can see this gentleman here, they're very tiny on either side. I like that picture because it gives a bit of perspective of how tiny exactly it is, but we do have 2 on either side and they need to talk to one another. So specifically the inner ear system, the vestibular system, detects our linear, our moving forward, but also our angular, so our twirling kind of movements, specifically our head in relation to space. It assists with our gaze stability. So it talks to our eyes. They have to come into agreement of how they're moving together, but it keeps our eyes actually moving with the inner ear. Together, this helps us to maintain our balance and our posture. So again, the fact that I'm tipped over, it knows. The fact that I'm upright. This is a big conundrum when people spend a lot of time in bed after being injured. Sometimes their body awareness switches and now their brain thinks that laying is up and up is laying. And so that's another reason why we have to address the inner ear, especially after being in bed for quite some time, because it can get altered, our perspective. And so then it also helps us to orient and have perception of our body. So with my arm out, my inner ear and my vision center is talking to my limbs, telling my brain exactly how far is my arm out, is it down, is it up? But also in relation to a chair, that's how I can walk around a chair. My vision system is talking to my inner ear system, and together they're sharing the information to the brain so that I don't run into the chair. So overall, it's just providing the brain, which is our central nervous system, with information about our posture and our eyes. So basically, in regards to our head. So if we're moving our head, if we're looking around, it's just, they all have to talk to each other to make sure we're all on the same page. And this gives us that sense of being in equilibrium, a sense of balance, which is very important. So again, this is just an example of how when you move your head forward, the little hairs in the fluid-filled canals bend forward to tell the brain that your head's now forward, and bent back to tell your head is back. So it's just an interesting mechanism. This is more of a visualization about exactly how the inner ear talks to all the different parts of our body. So we kind of forget about that. And some people just focus in on the inner ear, just focus in on the eyes, like optometrists. But we have to look at the system together as one. You can't address one without addressing the other. So the inner ear, obviously that's the inner ear system, but it talks to the eyes to make sure that the eyes move as fast as the inner ear moves as fast as the neck. If our eyes are tired, it can send an opposite message to the brain, and then the brain gets confused. If the neck or the body is off for some reason, our gait's off or walks off, or our neck's too tight, again, it can send an alternate mechanism. So that's when we turn our head, our neck, our inner ears, and our eyes all have to move at the same speed and relay the same information to the brain and to each other. The moment one of them is off, the inner ear is in balance with vertigo, or the neck's too tight, or the eyes are very fatigued, that's when we get that dizziness sensory. So it's just kind of indicating how they all have to work together symbiotically. And if they don't, that's where we get dizzy, and we have to figure out who's the culprit. So again, what does vestibular inner ear dysfunction look like? So this is what you would say to your doctor, what we hear as practitioners when people come in, that they say that they have an imbalance, they feel unsteady on their feet, maybe a bit drunk walking. They have a sense of walking and swaying. So that's like sea legs. They went on a boat and they never transitioned back. And that's why sometimes when we go on a boat, we're able to not have seasickness, is because our inner ear is actually transitioning, now telling our brain that the normal is swaying. But when we come off, our inner ear has to tell the brain, you're on solid ground again. But sometimes we don't do that, so we still feel like we're swaying. Again, if either the eyes, the inner ear, or the neck are not communicating, it often results in nausea and vomiting, which is probably the worst feeling most people don't want. Floating and swimming, again, that's a bit more with the eyes not talking to the inner ear. They're in a disagreement about what's happening. And so you get this sense that you're not quite right. You get lightheadedness. That's more in regards to your neck and the inner ear not talking to one another. Motion sickness, so that is your inner ear. So those car sickness people that can't go on rides, you have a hypersensitive inner ear system. So you sense the world a lot more than the rest of us. And that's why you get motion sickness, because you're super sensitive. There is treatment to that. It's called just deregulation. So we just kind of bring that down. But you actually have a higher sensitive inner ear. Vertigo, everyone knows what that is. So that's just where the crystals broke free in the canals and they're banging around, and we need to clean that up. and then oscillopsia. So that's if you're reading and all of a sudden reading words looks blurry, but moving, they're jumping, you're having difficulty doing a word find. That's your eyes getting mixed up with your inner ear and becoming sensitive. And so we address that as well, because we want to make sure that everybody's eyes are functional. Okay, so vertigo, I'm just going to address this because that's what a lot of people think inner ear is, and it's just one entity, but it does affect a lot of us, especially as skiers, hikers. They don't really know the complete reasons we get vertigo. Some people it's allergies, some people it's seasonal, and some people it's just random. So that's where you're feeling like you're spinning. Mainly if you were like laying in bed and you got up, or you went to bed, you laid down, or you rolled in bed. It's those three planes. You're moving your head up and down where you're spinning and you feel you're spinning or the room spinning. And your eyes are actually spinning because the inner ear tucks the eyes. And that's how we figure out which side it is and which canal you have the crystals banging. But the most important part about vertigo is it should last less than a minute. So as soon as you stop, it's like sand in an hourglass, it should settle. If you have consistent symptoms lasting beyond a minute, you can have vertigo, but now it initiated more. And that's why you have to come for inner ear rehab. We have to get your inner ear functioning again. So vertigo is mainly just positional movements that cause you to feel like you're spinning and the room's spinning. It should settle after a minute. And most of the time it recovers quite nicely by itself, but if it doesn't, again, we do specific maneuvers to just drain out those crystals and be done with it.
Okay, so just summarizing, we're here to talk about the vestibular system as part of the recovery from a mild traumatic brain injury. But there's three common dysfunctional causes. There's mild traumatic brain injury, mTBI, or more commonly a concussion. And with a concussion, to differentiate between acquired brain injury is that a concussion, we have no way of really testing. There's no MRIs, there's no CAT scan. They do now have blood testing that they're looking at, and it looks exciting, and there's potentially a future to that. The most recent, we went down in the States, the most recent conference we went to, they say it's probably about 20 years away. But it would be a blood test, much like for insulin and for sure people with diabetes, and it's a quick test to see if there is actually potentially a chemical. So it's a chemical imbalance in the brain that happens with it. Acquired brain injury, unfortunately, we can see that on a CAT scan or an MRI that there is injury, swelling, or bleeding on the brain. And then the third way is issues with the vestibular system, a hypofunction. And so those are the three really classifications of how the causes that can happen to affect our vestibular system. And you all know what a concussion is, and like I said, it can be with impact or not impact. So a whiplash, we have people coming in weeks or months after a car accident who have not recognized the fact that they've had a concussion because they actually didn't have a direct blow. They didn't hit the windshield, they didn't hit their steering wheel, and yet they have all the symptoms. And this is why we're out here to educate the community in that the sooner you get treatment, the faster you'll recover from a concussion. And so when clients come to us, we actually get clients coming, unfortunately, months later. We help 99% of the clients who come through our door and improve their quality of life because we cover these 6 factors of what you need to have assessed in order to recover from a concussion. And so at the top is vestibular. Vestibular is what causes the prolonged recovery. And we find a lot of clients who come to us through word of mouth or what have you, hear about us, that this is a significant portion of what has not been treated or assessed so that it could be treated and they're not recovering, or their symptoms are not manageable yet. We also do vision testing, which we're going to show you, to see that how the eye and the brain and the head, like Elizabeth talked about, works. There has to be management of the fatigue and of the physical fatigue that the body experiences, as well as the cognitive fatigue. And as much as it's out there about pacing yourself and doing the energy, it actually requires a real one-on-one conversation where we really talk and go through their life from the day they sustained their concussion until they met us that particular day. And so an interview can last up to 3 hours, because we're actually asking, what have you done? And we tease out the information that you provide us. You're actually giving us the answers that we can flip back to you and say, you went back to work too early. And we do pull people out of work, or you went back to school too early. We have to pull you back out and figure out a way how you can work through our testing of what's triggering the symptoms, what's making it difficult to get out of bed in the morning. And so this is not as simple as just pacing your day. It's figuring out what you can do in your day and what you shouldn't yet do with your day, and we're going to get there together. The longer we obviously have symptoms in any of these categories, the longer it takes to recover. And one of the most frustrating things for practitioners is when people come in with headaches that have not been addressed by the family doctor, talking about taking the Tylenol, or they're saying, don't worry, it'll go away. And then once the trajectory reaches into migraine, then it's really difficult to manage. The brain is now so angry that we haven't been listening to its complaint, that unfortunately this is something we try to really avoid, that we hope people don't go into the migraine situation of a complicated concussion or mTBI. And then, of course, we've already addressed, we have to treat the neck. Any neck pain, we have what's called a cerviogenic reflex. It's a really cool reflex in that it gives us a lot of information, but we don't listen to it. It gets ignored a lot from emergency to family doctors, that headaches can cause neck pain, tension, and discomfort in the neck. And then as the tension and discomfort in the neck accumulate, the brain or the headache symptoms get worse. And a lot of people's response is, I'm not recovered from my concussion. And you have recovered from your concussion. What we need to do is manage the cerviogenic reflex in the neck to say, don't be so hypersensitive, don't trigger headaches, headaches don't trigger neck pain, and we have to reverse that chain. And then lastly, we can't forget that it really sucks to have a concussion and to have an acquired brain injury. And so those moods of being depressed is totally normal, being sad, being anxious, being afraid are all normal symptoms, and we hope to address those. We can't ignore those. We are human and we go through a lot of emotions. And I had a gentleman who came in his 60s, and he said, he's laughing, but and crying. He says, Marianne, I can't stop crying. Like, this is crazy. I never cry. And so we have an emotional response, which is really the brain. The brain is sad. So our job when you come to our clinic is to figure out how we can make the brain happy again. And hopefully the symptoms will go away. And so the recovery, I spent the first 20 years of my career as an athletic therapist working with athletes, and 99.9% of the athletes recovered within 72 hours from their concussions. And there's a lot of reasons for that. They're not getting hit by a 6-ton vehicle with a motor vehicle accident. There's only so much force one human can put on another in a sports injury. They're very healthy, so there's a dramatic response from the body when an athlete is healthy and fit. It heals and recovers much faster. And so some of them just can resolve. If you do all the right things in the first 48 to 72 hours, you stop playing your hockey game, you don't go to work. We tell our athletes, don't go to school, just to make sure your symptoms subside. And when the symptoms subside, then there's nice recovery. They don't need our help. The people who come to us are the people who are not recovering in 72 hours or in 7 days, and they need to get help. And that's kind of the message we want to get out. You don't necessarily have to come to us because we have a mission, but we do want to get the mission out there that you don't have to live with these symptoms. The faster a concussion is addressed, the faster you will recover. So Elizabeth's going to talk about, and we're going to go through, and this is a part where even you, Sarah, we can all participate here, and we'll go through some of the testing that we do so you can now visualize it. And for the ones at home, you can stand up when we're all standing here, and you can try the movements that we're going to do to experience what assessment is like, and perhaps how you're coming along with the different, the 6 different parts of the assessment process that we go through in our clinic.
Yeah, so I'm just going to run through kind of what our assessment is. It's always good to know what's coming ahead. It helps calm anxieties, but also just see, again, like where are you landing? Is there something that we need to clean up? Some of my clients, they've checked off quite a bit of this, but it's one last thing that they didn't get checked off. So we're not seeing them too much. We're just seeing them once or twice. But we like to share our knowledge. Like we said, we don't like to keep it to ourselves. So we're just going to run through the information. So usually when someone comes in, we're both doing a history. How did it happen? Is it a car accident, sport accident? What angle? And then what have you been doing since? Have you been resting? Have you not been resting? What's your main complaint? Are you dizzy? Is it headaches? Or is your vision off? Are you just emotional? And then anything we also want to address is your goals. Obviously, return to work, return to sport. If you're a mom, get you back to helping out your kids. Just anything that is your goal, that's important to us too. We want you back to your life. So we always talk about that and where we're heading, just to keep on track. So then we go into our assessment. And so this is where we're looking at everything. So like we said, the vision's affected, the inner ear's affected, your balance is affected, your walk's affected, your brain memory is affected, and definitely your emotions. So we kind of just go through everybody to see where they land. The biggest thing is your reflexes are affected. So we want to just see, where are you on the spectrum? Who do we need to get back in order, and who's already back in order? We kind of tell our clients, we're just checking, like, we're used to being on the highway going 25 miles an hour and just so efficient in our day. And now we're kind of on a rural road. And so I just say, like, how many pots are we looking at? Are we on a potty rural road and we're really inefficient? Or is your vision back on the highway, but your balance isn't? Is your inner ear back on the highway, but your vision isn't? So we're just trying to scan everything to see where you are so that we can clean it up appropriately. So yeah, I'll do an eye screen, the inner ear screen. On top of it, like we said, your brain gets really tired pretty quickly. And when it's tired, just like when a kid's tired, they cry and get angry. So that's where we get into sensitivity. So some people also are coming with light sensitivity, noise sensitivity, movement sensitivity. So like being in grocery stores is a bit too much. Watching fast TV is a bit too much. Just simply seeing a piece of wrapping paper brings on symptoms, and that's our sensitivity. Our brain now can't tolerate all this stimulus. So we have to address that. We have to bring everyone back down, and then we slowly expose them. And that could simply be the one thing that's keeping you from recovering, is you never had your color sensitivity addressed. And so every color is just too much for the brain, and you're staying hyper stimulated. So we definitely go over that, and then balance and walking, and then your neck, like we said. So, and then we identify our treatment protocol. We put everybody on an individual program to get to their goals. We discuss your goals, and we go from there. So we're going to run through a bit of different testing, and then also eventually homework exercises.
So for the neck treatment, there is what we call functional movements when it comes to any joint in our body. and that everyone should be able to do this in order to do the daily activities of daily living. So we're not trying to be a gymnast, we're not trying to be an Olympic athlete, a professional athlete. We just want to get through daily life and enjoy it. So with our neck movements, we can all try this. And all our movements in our neck, you really should feel nothing, because you have the whole range of motion. So you should be able to look down at your belly button, and you may feel a little bit of movement at the back of the neck, but you should just hang there. You should be able to fall asleep comfortably, and there's no pain, tightness, or discomfort. You should be able to look over your shoulder, so the tip of your collarbone. So you're going from looking forward to looking over your shoulder. You may feel a little bit of pulling, and it should be balanced. So it shouldn't be pulling more on the right, it shouldn't be pulling more on the left. You're just spinning. Not quite like an owl, but we should get there. So we check both sides, and they should feel equally the same. You should feel a little bit of tension on this side, maybe a little stretching. It shouldn't be uncomfortable. And then you should be able to bring your ear to your shoulder about 45 degrees. If you're looking in a mirror, you can check it tonight when you're brushing your teeth before you go to bed, that you should have it should look like 45 degrees in the mirror. You may feel, if you feel anything, it should be on the opposite side. You really shouldn't feel anything on this side. And the same thing too, it should just hang there with just a gentle stretch. And so we address those, but when we're checking the neck, we also touch all the muscles. There's 3 major layers of muscles in our neck. And deep to the major layers of the neck are ligaments that hold our joints, our spinal bones together. So we can palpate the 3, and we thoroughly palpate, because a lot of times people have the movement, but when we actually touch the muscles, this muscle might be really tight on one side and nice and soft on the other side. Or the back of the muscle, the neck muscles may be very tight on one side, but not on the other side, and sometimes opposite. So we do a real thorough palpation of the 3 layers of the neck. And then we treat it, of course.
Good job. Yeah.
Okay, the other one is the inner ear canals. They're an easy, quick, let's get it done and get it out. If we leave the inner ear banging around, causing the spinning, then it just keeps irritating the brain, and we just want to be done with it. So obviously we quickly scan the inner ear. And so that's just doing specific maneuvers to see which side it is, which canal. Is it the horizontal? Is it the anterior? Is it the posterior? So I do a specific maneuver, I look at your eyes, I look at where they're spinning, and based on that, we do a maneuver to drain it out, and then you're done. We don't want to keep having the vertigo. One, it's awful to feel dizzy and nauseous every 5 seconds you move your head. So we deal with that and get that out of the way quite quickly, because there's no need to keep feeling that way. All right, so then I go into the eyes. So the eyes often become the system that trumps. So when our balance becomes too difficult for the brain to coordinate, when the inner ear is not functioning properly, the brain very much just trusts the eyes, and that's because majority of our brain is talking to the eyes. So the eyes become the guys, but when they become the guys, they then can't do their job, which is to scan and read appropriately. They become hypersensitive. So they become very choppy. They're no longer fluid. So I just scan the eyes to see, are they moving appropriately? Are they able to jump? Are they doing the things they need to do? And are you getting symptoms with it? Because if you are, then it's a good indication that the eyes are causing a bit of the issues. So I'll do some scanning side to side, up and down, and I'm looking at the fluidity of your eyes. Are they choppy? Are they overshooting and undershooting when we do a side to side check? And then we go from there. It's not usually we're talking about treatment, no, right?
No.
Okay. Okay, we talked about how the system can get overwhelmed. It can get hypersensitive to the surroundings because now it's struggling with everything to do. So some people become very overwhelmed by their situations, by their environment. So now grocery shopping makes them feel dizzy. And even being in the cars make them dizzy. So there's different sensitivities that we develop when the brain is so tired. And I even see this just plainly in my inner ear patients. So you don't have to have a brain injury to have these symptoms. You can have a function dysfunction in anything. You can have, I've had children in school with visual dysfunctions and they get the exact same symptoms as a concussion, but it's linked back to their eyes being inefficient. I have people just with vertigo, but they never got their system back on track, so they get the same symptoms. So we're talking not just concussion. I see this a lot with just vision dysfunctions, inner ear dysfunctions, and concussion. So when the brain gets so tired, it's no longer doing its job efficiently. It's really thinking about how to move the eyes, how to walk, how to balance. Everything's just such a thoughtful process. It becomes now overwhelmed. And so colors become overwhelming, your environment becomes overwhelming. You now don't tolerate being in the car because of the passing colors. And most of my clients will say, yes, I feel overwhelmed. I'm dizzy whenever I see it. I just feel off. I feel on guard. I feel anxiety, all these things. So we definitely have to pull out which sensitivities are bothering them. Is it light? Is it noise? Is it color? Is it movement? Is it TV? And what we do is we back them off again, and then we slowly expose them to it. So I kind of explain to my clients, if you have any children at home and they're used to like tapping you, on a good day, you can tolerate 20 taps before you need them to stop. But when you have the flu, you can tolerate maybe 3 and they just need to stop. Your tolerance is super low. And that's where you are with this. You just don't have a tolerance. And so we have to build it back up, but appropriately.
You want to go through the color testing?
Yeah, I can go back through that. Okay, so I do try to calm my clients down. That's the most important part. When they come in, they're so overstimulated, they're overwhelmed. And so our first goal, first and foremost, is to get them, their central nervous system calmed down. I want their brain to relax. I want their mood to get back to normal. So we often put them on a protocol of a rest sleep thing. We talk to them about that, but they often are now going to start taking naps. We plan their day out. But most importantly, color therapy. So in the vision world, we now know too that colors help to calm the brain down. So often I'm showing my clients different images to see if they get overstimulated. So I would use like this paper mat. And if they say, yeah, that's a lot for me, I'll also move it. And they say, oh yeah, even worse. Then I know they have color design sensitivity. And then I'll show them this crazy one. On a good day, that's hard to look at, but actually I don't get symptoms. You shouldn't really, it should feel like a lot, but it shouldn't be symptomatic. And then I'll move it. Again, they would say, they would look away almost immediately, say that's too much. Now I have an instant headache, or yes, I feel super dizzy. So what we want to first do is I take my clients through colors. And so I want to calm their system down. I want to stop revving their system up. That's the first step to getting us moving forward. So I'll show them my image with the color over top, and I'll tell them, tell me if this feels instantly better, like calm, your brain went, huh, or if it's worse or no better. And we start with finding all their favorite colors to help them feel like, what color does my brain feel good with, and what color does my brain not feel good with? And it helps to give them an idea of exactly why they're so overwhelmed in the grocery store and why they're so overwhelmed watching TV.
And this happens in the real world as well for people who don't have a concussion. So I'm going to give you guys here a piece of paper, and we're going to pass the overlay. And just for fun, you're going to try every color on this piece of paper, and you will definitely find a color that say, that white is not as white, it doesn't hurt my eyes. Okay, so we're going to pass out a piece of paper.
In general, most people do like blue. That's most of my clients, blue.
So you start
Is
with
used
green and
as
then you're gonna
a-
pass them around. So you start with a few colors.
Yes, blue's a cool color. It is now seen to be a central nervous system depressant, so it helps us to really rev down. So some people that also are feeling anxious, I have some anxious students, they aren't concussed, but they do feel anxiety at school. If we give them blue sunglasses, they actually feel calmer in their classroom. It calms our central nervous system down. But there are the unique people. Some of my creative people do like orange, but that's just what we're doing. We're trying to get the system revved
Did you find a
down.
color? Just one second. So did you find a color that you like?
You don't like the blue? No.
No.
That's a dark blue, maybe try this one.
Yeah,
I
so-
got this one.
One
It's a
gentleman's
lighter
trying
one.
it
Okay, you
and
got it.
he
Yeah.
doesn't
Yeah.
like the blue.
Yeah,
So what do you
You
find
should-
when you put the green on?
yeah.
And now put the blue back
But,
on?
but it is again, it looks like too much.
Okay,
Yeah.
and so
Yeah.
what happens if you put the blue on?
This one, it is a little better, but it doesn't look nice. The
Okay.
yellow-
There are
Okay.
people that are
none
different. I
of-
have a couple
none of
people
them.
that like
Yeah, try
orange.
the
We go with
yellow.
what we
Yeah.
like.
And see what the
Yeah,
yellow does.
oh, it is.
That's too
Yeah.
much.
Yeah, instantly yellow is not usually good. It's a very vibrant color.
Orange and red, I can feel my eyes drawing into my skull.
Yeah,
Oh,
there are
okay.
some that you will have a dramatic,
The optic
yeah.
nerve, I can
They
feel
look-
it.
they look very, when I'm holding it gives me different impression.
Mhm.
When I put over here, it gives me different.
impression,
Mhm.
exactly. And that's why we put the
Changes.
bright white, that's why you put the bright white paper there, because it helps a little bit in trying to figure out, did you
Yeah.
find a color that you preferred?
Oh, blue. Blue's
Yeah.
always
Blue?
been my color for years.
No, but was it more calming
For
for
your,
Yes,
you?
when
it
you read it,
was.
yeah.
And
Yeah.
I like blue even more.
And what did, the light blue, and Sarah, what did you find?
I was gonna say the blues and the pinks seem to kind of like calm my eyes down a
Calm your
little
arms
bit.
down?
Yeah.
Yeah, and there's some people who, do we even have, oh yeah, we have, this green is a little dark. But we do have people who like the green and yellow as well. They
So
find
it's
it
an
more
easy
calming.
test. I usually get those
Mhm.
overlays at Walmart, so I'm not sure if you're a medical professional listening,
What
but
is it?
it's easy test to see what helps to calm people down.
Go ahead.
And I'll even put it on some of my clients that are just having a lot of anxious feelings in my session, whether even if they're just a sport injury, I find the blue helps to calm them down.
My body starts shivering, trembling.
Yeah,
Oh, you're having a real effect.
yeah.
Yeah.
So that tells you maybe when you're out, why sometimes like maybe
Yeah.
colors are what set you off.
Did you bring your sunglasses?
Yeah, they're right there, but that's.
Oh,
okay.
yeah, so, just to show you, we do order, we have in the clinic, different colored glasses. So you can try these on as well. We usually,
Wow.
My
so-
students at Brock.
so we have,
definitely
just for
like
the
them.
people at home, we have, whoops,
Yeah, what
we
the-
have pink glasses, and for some people, it feels much better, so we have.
I get those on Amazon. They're John Lennon glasses.
We have purple ones, and people come and arrive in our clinic with their glasses that best suits them, blue, purple, yellow.
So
and
what
we
we're
have-
doing is we're just trying to calm their central nervous system down, and it gives their central nervous system down, their brain.
Can I try a blue pair?
Sure, yeah.
It gives their brain some extra
That's my color.
energy because
Just
it's
for
not
fun,
dealing
there's
with
a
all the
pink one.
colors. Is that a question?
Oh, no, someone said they did the light therapy with their neurooptometrist.
Yes,
And
very
light
good.
blue
Ah.
for reading
Pulling
used
it
to
a little
help.
bit.
Yeah,
That's awesome.
How was
and
that?
green light.
Pulling it.
Fuchsia
a
emergency
muscle
glasses
to my
helped
neck
after
a little
crash.
bit.
Yes, perfect.
Yeah,
Yeah.
that's awesome.
What
That's
was that?
great. This person went for vision therapy. Yes, a neurooptometrist. I do refer to a couple. They do some great vision therapy. They'll start people with the
Oh.
blue, wean them to green, and then
Really?
pink. So that's
Watching
awesome
the
that you
eyes
did
start
that.
watching.
Not
Wow,
everyone is
right?
that lucky to have that.
I don't have a blue one here.
Dr.
Oh,
Hopkins is a
of
great
all
person here
colors.
in the area.
Oh, pardon me.
What's that?
All right.
Look like blue without glasses.
Yeah. All right, and then we look at your balance and your your proprioception, that's your body awareness, and your gait retraining. So some people, because the inner ear is off, they look like they walk like a drunk. So we work on those
Yeah.
things.
So we're gonna, this is another way we can all participate. If you want to go towards a wall or stand near the pillar in case you lose your balance. But so those ones that people at home, we'd like you to stand up and we're gonna test our balance. And we had one interesting client, I'll never forget, he was in his 30s and he was at home for 6 months. At a point he came to us, he was pretty frustrated, had been around and about. And so his, it took 3 hours, 3 different appointments to go through, but we eventually teased it out. His only issue was balance. And when he stood there, he did not realize it, but he actually was like a hurricane standing there in front of us with his eyes open. And you can imagine what your head feels like. You just got motion sickness all day doing that. And so we started with simply, he had to stand against the wall with his back against the wall and just stop his body from moving. And he only came to see us every 2 weeks. And every 2 weeks, we advanced his balance exercises. And within like 4 weeks, his whole symptoms had just tremendously decreased. And he was quite angry because no one had really assessed this component. And like I said, in our 6 areas, we have to look at everything. And so with our first test, all we want you to do is stand and put your hands on your hip. And you're looking straight ahead, don't look down. When we look down, that gives us a lot of information, but looking straight ahead, our brain doesn't get as much information. And then you should be able to do it for a minimum 30 seconds. And we actually do it for the full 30 seconds because it's interesting what happens around the 22nd mark. Around the 22nd mark, we start seeing some of our clients swaying because now the brain, the vestibular system have fatigue. They literally can't keep you upright. And so then the next step, sorry, what's your name?
Jared,
Can you go towards the wall or the pillar?
with the cane.
With the cane, yeah, just go closer to the wall. So if you lose your balance, you can use the wall line. So just come over here.
Maybe the door.
Oh, good.
Just come over here. Just come closer to it, switch your cane to the other side. And then face us.
Yeah, all right, we'll turn
So
this
you can
around
just
for
grab
a,
a wall. There we go. So you can just grab a wall if you lose your balance. Same thing. Don't stand with your back to the wall, just stand facing Elizabeth.
Shoulder.
Yeah,
Yeah.
there we go. Okay.
so let's see, what are they gonna try, or is this just to help them stop from swaying?
That's if they lose their balance.
So that's one of the things you can do to help if you ever feel like you're just,
So no, just for the testing. So
Okay.
if they lose their balance, they can grab a
Okay.
wall. It's a safety issue.
just for
Yeah.
safety.
Okay, so then you're gonna stand with your hands on your hips and you're looking straight ahead. And then let's go for about 10 seconds. And then hopefully your elbows aren't touching the wall. If they are, move just a tad away. And so we're going 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And if you feel you're ready, close your eyes, pretending you're looking straight ahead. Focus in on your feet, that your feet are holding your balance. And if you lose your balance, don't fall over, don't sway too bad. So there's a couple things. We can potentially observe you swaying as we're assessing you, or you actually get symptomatic. You may feel a little dizzy inside or like motion sickness, or both. We may see you swaying, or we may see you a little bit symptomatic.
It's hard.
Yeah.
It's really hard. And
What's happening?
The balance.
Oh, he's tired.
Tired.
And
Yeah.
his eyes are watering and it's because it's challenging for him.
You're challenging.
Water.
Yeah.
We're challenging your balance.
Why don't we sit back down?
Yeah.
Just,
And so,
I have balance issues for
Okay.
another reason, might be part of this, but I was in a really bad car accident, so my hip
Okay.
has never been the same.
yes, and sometimes it can definitely have some muscular issues or
The
issues.
bone itself.
And so the next step that we do there, you guys can rest here, is you stand on one leg. And oops, you can't see me. Sarah, do you want to
Oh, it's
adjust it a
always
little bit?
hard
So you're
to-
standing on one leg
Yeah.
and you're looking straight ahead with your hands on your hips. And you should be able to do that for 30 seconds. And this isn't being a gymnast or anybody fancy. This is a normal activity we should be able to do. And then the final step is doing it with your eyes closed and you're standing on one leg and not moving. And then we advance it to an uneven surface. So you should be able to stand on a pillow or a cushion on your couch and just stand there, same thing as if you're on solid ground. That's kind of the final stage where it becomes a little bit dynamic. And it's what we experience every day. We walk on grass, grass is uneven. We walk on a pavement that's uneven. And so this is some of the balance testing. When we get into, depending on what people want to do, you don't have to be an athlete if you would like to go back into golfing or you want to go back into pickleball, that's really popular these days. Then we start adding pickleball kind of activities that you're trying to hit a ball standing on one leg and so forth. Standing on one leg, interesting.
All right, so obviously with, when we're done our assessment and we do all this in the clinic, we also send our clients home with exercises to do. This is mainly your time to shine. We see generally our clients just once a week because it does take the brain time and the inner ear time to work. For my inner ear specifically people, I might see them more, and my vision people more times a week. But that's because their brain's not concussed, so they can move along a little bit faster. But if we are having a concussion, then you need to go home with some exercises and work on that. So it mimics a lot of what we did today, but I often give them different exercise sheets. So generally I start with some fun little nursery rhymes. This is to work on their eye tracking. So they have to use their eyes and track forward and back. If that design is a bit much, they will use their color overlay, sunglasses, or even we'll just practice with tracing it. So they start with that. Eventually we do, if the eyes can't work by themselves, then they definitely can't work with the inner ear system. So generally the home exercises are first starting with a simple eye exercise, a simple inner ear exercise, a simple balance exercise, and eventually I'm pushing them all together where we're multitasking. And then they'll get some periphery exercises. So that's like walking and pointing to objects, again, understanding your environment. Again, we work on desensitization. So if they are color sensitive, movement sensitive, I'll give them different little pieces of wrapping paper to stare at, to start desensitizing them, to start them. They'll just look at it for 3 seconds and then put it away. And then maybe tomorrow they can do 4 seconds and then 5 seconds. It's good to build that tolerance back up. Again, it's specific to my clients. So I've tested them. I know what their issue is. I'm giving them a specific task to do. We went over balance. I will teach my vertigo clients the maneuvers if they are having repetitive episodes. I can't always be there, so I try to teach them how to do it appropriately. But I do recommend you see someone first so they can tell you which canal it is, because when we attempt it ourselves, we sometimes get it into the wrong canal. Cardio and strength training, at the end of the day, we are an athletic therapist and a physiotherapist. So strength training and doing cardio helps the blood to flow, helps the brain to recover. It helps with our posture awareness. It's strengthening us. So there's really good effects, and not to mention the mood effects. We always feel good after. And then we have specific return to academics, work, or sport hobbies. So obviously, if you're my football player, we're doing a little bit more intricate hand-eye coordination exercises specific to football. If you're going back to a computer desk, again, we're working on ergonomics. So everyone's very different, very individualized, but we can work together and figure out the best treatment for you.
I have a question.
Yes.
Are these all systems you've developed over the years?
Like it's through research we've come up with our assessment. So she asked if this is a system that we've developed over the years, which it is, through all the information from the concussion conferences to the courses that we've taken. We've developed our own system and it seems to be working.
Oh, I just wondered.
Yeah,
It came to me.
Yeah, and just to add to your question, 30 years ago,
Mm.
we didn't do a lot of this stuff.
No,
We
we
didn't
didn't.
know it. It wasn't because we were negligent. You hear about in the NFL and the NHL, these professional athletes are
Yeah.
suing their organizations
yeah.
and so forth. And it's not because we didn't know what to do. It's at that time, there wasn't all the research that's available now. I mean, it's been growing from 30 years ago. We were treating concussions in the best way that we knew at that time.
Wasn't part of the thinking. I
But the
guess.
biggest
Yeah.
problem, even 15 years ago, is that people didn't like to admit that they had a head injury. They didn't like, people didn't want to talk about their, and that's, I'm not talking like 15 years ago, people didn't want to talk about their symptoms. And it's hard to say why. Within the athletic world that I was involved with, they were worried about getting cut from the team for not getting playing time, and so they
Yep.
didn't talk about it. And so fortunately now, but we still see it, like where an athlete's had a concussion and they still don't talk about it. And
Not a
so
part of the game.
and
The attitude.
and unfortunately for the people in motor vehicle accidents, the first place they go is ER, and they're so caught up with broken bones and other
got it.
complaints. That's, I don't know, it's still not adjust. We had a
Mhm.
gentleman that we're treating now where they had a vertical elevator, the elevator landed on his head, and all they were worried about was his neck.
Oh.
And he came to us for neck treatment, and we said to him, well, what about your concussion? And he says, I have a concussion. I mean, that would be us in our concussion world, would be,
Yeah.
the concussion would be the bigger problem. That something hit his head really hard. His chief complaint was originally his neck. But then within days, his symptoms for his headache start to escalate. And then he came to us for neck treatment, which turned into an mTBI treatment as well as a neck treatment. So that's why we're going around talking to people and trying to put concussion to the forefront.
Boy, does that sound familiar.
And
Exactly what happened to me.
yeah.
So that's just our resources, our Instagram account, Active Life Rehab _NCN, Nagrish Management. We're also on Facebook, and our phone number 905-358-8088. Feel free to contact us if you have any questions, you're not sure where to direct your care to.